The United States healthcare system has a long and complicated history when it comes to indigenous rights. Over the years, Native American tribes have been subjected to numerous policies and practices that have stripped them of their rights and access to quality healthcare. From forced relocations to the Indian Health Service (IHS), Indigenous people have faced considerable challenges when it comes to healthcare in the U.S. The Indian Health Service (IHS) was created in 1955 as part of the U.S. government's efforts to address the healthcare needs of indigenous populations. The IHS provides a wide range of healthcare services, including primary care, mental health, and substance abuse services. However, the IHS is severely underfunded, and the services it provides are often of lower quality than those of other providers. This has resulted in indigenous populations having limited access to healthcare and receiving inadequate care. In addition to having limited access to healthcare, indigenous populations are often subject to discrimination in the U.S. healthcare system. This includes unequal access to medical care, unequal treatment by healthcare providers, and lack of culturally appropriate care. Indigenous populations are also disproportionately affected by poverty, which can limit their access to necessary medical services. In recent years, the U.S. government has taken some steps to address indigenous healthcare rights. The Indian Healthcare Improvement Act, IHCIA, was passed in 2010, and it provided additional funding for the IHS and authorized new programs and services for indigenous populations. In addition, the Affordable Care Act, ACA, extended healthcare coverage to many indigenous people, including those who are members of federally recognized tribes. Despite these advances, indigenous people in the U.S. still face numerous challenges when it comes to healthcare. Many indigenous communities still lack access to quality healthcare, and they are often subject to discrimination and unequal treatment. In order to ensure that indigenous people have access to quality healthcare, the U.S. government must continue to invest in the IHS and work to eliminate the barriers that prevent indigenous people from accessing healthcare services.